Key principles for HTA. The structure of HTA programs. Principle 1. The goal and scope of the HTA should be explicit and relevant to its use. In short, any HTA should start with a scoping exercise that outlines both the main questions are, that the HTA seeks to answer, and the anticipated impact of the good or service being assessed. This process should include all affected stakeholders and interested parties, so that the HTA is grounded in a common understanding about the overarching aim of the HTA, and to ensure that all relevant evidence sources have been identified. Furthermore, the allocation of healthcare resources is a complicated, and sometimes ethically challenging or controversial topic. Therefore, by engaging with stakeholders ensures concerns with the topic of the HTA, and any potential issues are tackled head-on. Additionally, a transparent and systematic process from the outset ensures that all possible cost and benefit considerations are included, thus producing the most rigorous and comprehensive assessment of the new treatment, intervention, healthcare service, or good is undertaken. Principle 2. HTA should be an unbiased and transparent exercise. As briefly touched upon in Principle 1, to ensure that an HTA and its findings are acceptable to all interested parties, it is important that it is conducted in the most transparent and unbiased manner. A new provision of healthcare will be of interest not only to patients and clinicians, but to a number of others such as healthcare insurers, the general public and sometimes, politicians. Each will have their own priorities and specific motivations and interests. This is why it is really important that HTAs are conducted independent of these bodies, by those unaffiliated with any particular interest. Commonly, expert panels or advisory committees are consulted to reduce the possibility of bias in the process. Principle 3. HTA should include all relevant technologies. It is important that when HTAs are being conducted, they consider all relevant existing treatments, drugs, medical devices, and care plans when seeking to compare the new technology to those already in existence. The HTA aims to inform its reader, the decision maker, of the best possible allocation of their available resources. Without including a clear understanding of what is currently done, this is not possible. Principle 4. A clear system for setting priorities for HTA should exist. Deciding what topics require HTA and should be prioritized for review, should be done in a systematic fashion. Conducting a HTA requires time and resources, and no healthcare system can afford to assess all technologies, they simply must prioritize which are the most important. Deciding what should be assessed could be determined by establishing a set of criteria. For example, in the UK, the National Institute for Health and Care Excellence, or NICE, prioritizes based on the following criteria: the likelihood of the guidance having an impact, the burden of the disease, resource impact, the presence of variation in practice, factors impacting the timeliness of guidance, and the clinical and policy importance. Being able to create a predefined criteria for assessment can promote a more transparent, trusted and fair system.